I've been a speech-language pathologist for the past more than 30 years, and I've always been interested in communication problems and language problems, and children with autism present with very severe problems in social communication and language. Autism is a developmental disability, and it really covers a spectrum of problems, a wide range of disabilities, but the key features of autism are difficulties in social interaction, communication and language, and also the presence of repetitive behaviors. Now my involvement is mostly with student training in autism, especially through our autism certificate program and also through my work in families. I think just as a speech pathologist, I learned that if you don't have the families on board, you know, that they're the ones that are with the child 24/7, they're the most vested in the child, that I think the really important work has to be done not just with the child, but also with the parents. My approach, which is really to work with families in a more developmental, social, pragmatic way, lies on the more unstructured part of the continuum, but always recognizing individual differences, that some children need structure. It's really what each individual child needs. But I think most important is to get the families involved, to really teach families strategies that they can use with their child at home. So my work is really focused on that, working with the families in small groups, teaching them how to work with their children, giving them very specific strategies to engage their child, to interact with their child, videotaping them and giving them some feedback as to how they're doing with incorporating these strategies. My focus right now is to bring a clinical component into our own master's program. We have a master's here in speech-language pathology, and certainly the students in the autism certificate program could be involved in this endeavor as well, but to bring some special trainings here on campus that involve parents, where they could come and engage in some small workshops to learn about working with their child's communication and language. So right now I'm focusing more on the clinical piece, but there's always clinical research that could come out of that.